Hey everyone, and welcome. So, you're getting ready for your practical pediatric first aid assessment? You've landed in the perfect spot. This is going to be your quick-fire study guide to really lock in the key skills for handling these acute medical conditions and, honestly, just to get you feeling super confident.
Look, it is totally normal to feel a bit of pressure, but we're about to turn that into pure confidence. In this explainer, we're going to power through the 5 big ones you'll be assessed on: a diabetic emergency, an asthma attack, angina, heart attack, and stroke. We'll cover how to spot them, what to do, and exactly when to call for backup.
All right, let's dive right into our first scenario, the diabetic emergency. Now, the one you're most likely to come across is a hypo, which is just a low blood sugar episode. And let me tell you, your quick action here is absolutely critical.
Okay, the first thing you have to understand is just how fast this can happen. A hypo comes on in a flash. You're looking for those classic signs, you know? Pale, kind of clammy skin, and a really sudden change in their mood or behavior. The treatment is just pure logic. Their sugar is low, so we give them sugar. And honestly, your calm, reassuring voice is half the battle while that sugary treat gets to work.
And this, right here, is your critical decision point. It's all about knowing when to escalate. So if you've given them sugar, but they just aren't bouncing back, that is your trigger. That's when you call 999. And if they become unresponsive at any point, you immediately shift gears and get ready for basic life support.
All right, let's move on to scenario number 2, the asthma attack. This one is all about breathing difficulty, and your job is to be that calm, steady presence that helps the child manage the attack using their own medication.
So, spotting a severe attack is absolutely key. If a child is struggling to get a full sentence out, that's a huge red flag. Your action plan is simple and supportive. First, help them sit up. Whatever you do, don't let them lie down, because that just makes breathing harder. Then you help them with their blue reliever inhaler. Quick heads up, they might have a spacer device which makes the medicine work way better, so just be ready to help with that too.
And this is the moment a serious situation becomes a flat-out emergency. You need to call 999 immediately if that inhaler isn't doing the trick, if they seem to be getting worse, or, and this is a big one, if you know this is their very first attack. You have to be ready to start basic life support if they stop breathing.
Next up, we're going to tackle cardiac emergencies. Now, I know what you're thinking. A heart attack or angina in a child? And you're right, it's less common for sure. But it can happen, and the principles for recognizing and treating chest pain are a vital part of your first aid toolkit.
The easiest way to think of angina is like a temporary supply and demand problem in the heart. The heart needs more oxygen than it's getting. That's exactly why rest is the very first step. If they have their own medication, like a GTN spray, your job is just to help them take it. What that spray does is relax the blood vessels, making it way easier for blood to get through.
Now, a heart attack, that's a whole different ballgame. This is a blockage, and the key difference is that the pain is persistent. It will not go away with rest. This is a 999 call. No hesitation, no question. The best thing you can do while you wait is get them into the W position, sitting on the floor, leaning back against a wall with their knees bent. It just takes a ton of strain off the heart.
And this right here is probably the single most important rule to remember about chest pain. Don't worry about trying to figure out if it's angina or a heart attack. Your job is not to diagnose, it's to act. If there's chest pain, and it's bad or it's not going away, you treat it like the worst-case scenario and get expert help on the way, period.
Okay, our next scenario is a stroke, which you can think of as a brain attack. It's what happens when the blood supply to part of the brain gets cut off. Recognizing the signs fast is everything, and luckily, there's a really simple test to help us do just that. Pay close attention here, because this is a core skill you'll absolutely need to demonstrate. Just walk through it calmly. F is for face. Ask them to smile and see if one side droops. A is for arms. Ask them to raise both arms. Can they hold them up? S is for speech. Is it slurred or strange? And T, well, T is for time. If you see even one of these signs, it's time to call 999.
So you've made the call. What do you do while you wait? Well, your actions are still vital. Try to note the time the symptoms first started. That's crucial information for the paramedics. And super important, Do not give them anything to eat or drink because their ability to swallow might be affected. Just keep them comfy and keep an eye on them.
You'll hear the phrase, time is brain. And let me tell you, that is not just some catchy slogan. It is a hard medical fact. Acting fast gets that person to treatments that can literally save brain function and dramatically improve their chances. Every single second counts.
And this slide, well, this brings everything together. This is the ultimate rule that overrides everything else. It doesn't matter if it started as a diabetic hypo, a bad asthma attack, or a stroke. If that child becomes unresponsive and is not breathing normally, your training all defaults to one thing: DR, ABCD, and high-quality CPR.
And that is our power-up. We've flown through the what, the why, and the how for 5 pretty critical medical emergencies. You have the knowledge. Now it's just about having the confidence to put it into action.
Think of this as your mental cheat sheet. For every condition, there's a key word and a key action. Boiling it down like this is what helps you stay focused when things get stressful. Keep this simple framework in your head, and I promise you will perform with clarity.
At the end of the day, you're not just getting ready to pass a test. You're preparing to be the calm in the storm. You have the knowledge. You know the steps. So now you just have to ask yourself, are you ready to be the person who steps up and acts when it matters most?